Now I want to get back to gum disease, and this is including gingivitis, old fillings and crowns that we talked about earlier, and crooked teeth. They're actually a bigger healthcare problem than I thought, and probably the same for a lot of our viewers. Now we also want to talk about health insurance premiums, which are continuing to grow out of control. It sounds like it's really more important than ever for all of us to take steps to reduce our chances of more serious problems down the line, like diabetes, Alzheimer's, and heart disease. So we're talking today about relaxation dentistry. So doesn't it seem important that you would offer that to your patients and that you're really providing them with a simple answer to these complicated and serious problems?
Well, we all hear the statistics, the epidemic of diabetes, heart disease, the growth of Alzheimer's, and if there's things that we can do, you know, especially as boomers. Like I said, I'm a boomer myself. I think, look forward to not only adding years to our life, but life to our years. You know, meaning that these people want to be active and vital into their retirement, or even if they decide to keep working. And the fact that we can help people with, you know, not only their teeth and their smile and self-esteem, but also their general health is very important.
So it's really about improving people's lives and the quality of their life.
Absolutely. Couldn't agree more.
Well, I have to say I'm definitely convinced. And when we come back, we're going to talk about one of the fastest growing segments of dentistry, implants. You're going to discover what implants are and who is a candidate for implants. If you've got missing teeth or loose-fitting dentures, implants may be the perfect answer you're looking for. We'll be right back to find out more. Welcome back to Relaxation Dentistry with our very special guest, Dr. Ralph Reilly. Dr. Reilly, I've been hearing more and more about dental implants. What exactly are they?
Well, dental implants, simply put, are a synthetic, usually titanium, root form that's placed in the jaw where the natural tooth used to be.
Now, who would be a good candidate for implants?
Two parts to that question. One would be anyone who's missing a tooth, whether it's one tooth, a section of teeth, or all their teeth. And the second part is it's available to a lot more people than it used to be. Initially, people that did not have enough bone in their jaw, or were a smoker, or medical considerations like a diabetic, were not considered candidates. And now today these people are being routinely treated.
That's great. So what happens after an implant is placed? What happens afterward?
Well, then it's a matter of fabricating the tooth or teeth or whatever the process is that goes on top of it, making sure it's perfect in their bite and their smile and shade and everything's just a perfect match with their natural teeth, or that the whole makeover of implants is just right.
That leads me to my next point about a friend of mine who had a tooth taken out a while back. She had her tooth extracted. And she told me that she got mad because her dentist ground down the teeth on both sides of the missing tooth down to nubs, as she called it. And she said there was nothing wrong with those teeth, but now they have caps on them as a part of a bridge. And she said she gets upset because she has a dark line along her gums and it's very hard to keep clean. And there's also that bad odor coming from the bridge. Based upon what you told me earlier, that bad odor is chronic bacteria, which we all know is not good for our health. Would she have been better treated with an implant? Would that have been a better solution?
Well, it sounds like for your friend it would have been. The neat thing about an implant is you don't have to touch the tooth on either side, and that it is a single tooth that's flossable and cleansable just like a natural tooth.
Now, can you give us an example of a patient that you treated with implants and how it affected their life in a positive way?
Oh, absolutely. As a gal that comes to mind, had extensive dental work her whole life, to where she had mostly a whole mouthful of crowns and bridges and root canals that unfortunately were all failing, and the teeth could not be saved. She was a very beautiful woman, took very good care of herself, was very concerned about her appearance, and mostly did not want anything that was removable. And on top of that, she didn't even want anything removable during the whole process. So we worked with leaving some teeth and bridge work and putting in implants, and in several stages we were able to redo the woman's entire mouth with implants. She also, like I said, was very concerned about her appearance and was looking to perhaps have mini facelift accommodated with this, to where we wanted to alleviate some of the wrinkling around the mouth and the lips. So we worked with building things out, opening her bite a little bit, to where not only did the teeth look great, but it also, like I said, was what we call almost like a mini instant facelift also. And in the end, she was just ecstatic.
I bet. Sounds like you had an impressive result. It's pretty amazing that you can do that much with one procedure.
Oh, absolutely. This woman, I mean, besides biting into an apple, a sandwich, just has a knockout killer smile that before she was worried about these bridges falling out and things, and now she's just so much more secure and confident. Big, huge change for her.
That's an amazing story. Now, Dr. Reilly, I know I'm going to put you on the spot a little bit here, but I want to go back and talk about sedation dentistry. Now, I've heard of dentists on the radio calling themselves sedation dentist, and I've even read Yellow Page ads that talk about sedation dentistry. Now, you've told us about relaxation dentistry and how it's a dental experience that includes sedation. But I think it's important for our viewers to know that even though you can give someone a pill to relax them for a dental procedure, that doesn't mean the dentist has any advanced training in cosmetic or another type of dentistry that I might need. Now, to me, if it were me in that position, I would want a sedation dentist that's highly trained and experienced. Can you touch a little bit on that subject for us?
Certainly. A lot of times people that are sedation candidates have not been to the dentist in a long time, unfortunately, and they may have some complex, extensive problems in their mouth. And we like to say, you know, big problems require big experience. And, you know, not only are we completely certified and trained in sedation, and not only is our office set up to be a very patient-centered, customer service type, relaxing atmosphere, but again, I've been blessed to have had some tremendous training to where we can do tremendous amounts of work in relatively few visits. Again, restore somebody's mouth to, you know, where they might not need any dentistry for a long time. And again, it's a lot more of the experience, you know, not just giving someone a pill, like you said.
Now, do you need a permit for this kind of dentistry?
Yes, we do. In New Jersey, as I mentioned earlier, they instituted mandatory requirements of training, equipment that we have to have in our office, and we are totally compliant with that. And I am a holder of an enteral sedation permit for the state of New Jersey.
Wonderful. Well, I have to say that I've learned a lot of interesting things today just from talking with you, and I'm sure our viewers have as well. And also, I want to point out that you've made a really positive impact on the people that have come into your office, and the dedication that you have is really a benefit to all of us. And like I said, I've certainly learned a lot today. So I want to thank you for being here.
Oh gosh, it's been fabulous. Thank you.
Well, we are just about out of time, so I want to thank you again for being here today. And before we go, I want to talk about the value of your life. Now, as you know, life goes by way too fast. In fact, medical research is now proving that the quality of your life has an ever-increasing dependence on the quality of your mouth. From social acceptance to more serious health concerns, it all starts in the mouth. With healthcare premiums skyrocketing year after year, with more and more adult baby boomers being affected by Alzheimer's disease, diabetes, and heart disease, and an ever-increasing, more competitive younger workforce, doesn't it make sense that something as simple as a visit to Dr. Reilly's office may just very well have a significant impact on your health and your confidence? Many people go through life covering their smiles with their hands or lowering their faces because they're ashamed of their smile. And unfortunately, even more people go through life living with gum disease and bad breath that's proving to be very costly to their health. Well, it doesn't have to be that way. Relaxation dentistry is a simple answer to help you look and feel your very best. Simply put, relaxation dentistry is an investment that will pay dividends for the rest of your life. Now, that's the way to live your life. Your smile and your oral health are a reflection of you. If you want to look your best, if you want a healthier mouth, if you want a healthier life, if you want to give relaxation dentistry a try, give Dr. Reilly's office a call right now. You'll be amazed at just how comfortable, fast, and rewarding a new smile and a healthier mouth will be. I'm Frances Powell. Thanks for watching.